Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Reflex responses to intubation. We have two main responses to intubation. Once the patient is intubated, systemically there is activation of sympathetic system. This sympathetic system will include tachyarrhythmias. This sympathetic system will cause tachyarrhythmias, that is increased heart rate. It results in increased blood pressure, that is hypertension. It causes increased intracranial tension. The local symptoms include laryngospasm. In order to blunt these responses to intubation, we have to use deep plane of anesthesia, that is local anesthesia, or lignocaine. It can be used. The lignocaine can be used either in spray form or it can be used as IV. We should wait till the patient goes to deeper plane of anesthesia. Opioids can be given in high risk cases where tachyarrhythmias or hypertension is suspected. We should give beta blockers and calcium channel blockers. Other reflex responses to intubation are systemic responses like hypertension, tachyarrhythmias, and increased intracranial tension is seen, and local responses like laryngospasm is seen. In order to control all this, or in order to decrease all these, we will have to treat the patient, or an anesthesia is administered only, or surgery is started only at deeper planes of anesthesia. Local anesthesia can be given either as spray or intravenous with lignocaine. Opioids can be added. Beta blockers and calcium channel blockers can also be given in high risk cases. So these will decrease the reflex responses in the patient due to anesthesia.
thank you and thank you for watching.